I just sent a patient in for an emergency operation for one of the most painful conditions that you can have, and a lot of people don't know about it, and I think everybody needs to be aware of it. I'm Dr. A GP based in the UK, and this condition is an infected pilonidal sinus. So pilonidal sinus is a very small hole and a tunnel at the junction between your lower back and the top of your buttocks. Now, a lot of people actually have this without knowing about it, because if it's not infected, most of the time most people will have no symptoms. However, if these sinuses get infected, they can be very, very painful and actually very bad, and almost always need an operation. So I've known of cases of patients in plastic surgery because the sinus was so big and infected, the amount of tissue removed was vast, therefore needed replacing. And these are the symptoms you need to look out for. The obvious one is pain. Now, this is a very, very bad, severe pain, and it does not get any better. And it's in the lower back around the buttock area. You might also have some bleeding and discharge from the lower back and the sinus. The early sign is often just a small bump at the lower back that's a bit tender. Now, if it's left, you can become septic from this and you can become very unwell. You can have a fever, chills. Now, we don't fully know what causes a pilonidal sinus, but here are three of the most common reasons why you might get one. So the first one is from general friction from the top of the buttocks. This can push hair inwards into the sinus. Secondly is having loose hair that gathers in the area. This can enter the sinus, which can become infected. And finally, if you're sitting for long periods, you're at higher risk of getting infected pilonidal sinus. Treatment for an infected pilonidal sinus includes an operation and antibiotics after this. If you have a pilonidal sinus that's not infected, you may not need an operation or antibiotics, and just keep an eye on it to make sure if it does get infected, it's treated quickly.